Okay. So, uh, you know, uh, like first of all, if you're doing something, you should be thinking that I mean, if you're attending some lecture, you need to know that what I'm expecting, what I'm gonna take from this lecture. So from this lecture, you will know about the DCH exam, what it is, what are the benefits, what are the pros and cons, then what is the pattern of this exam, then what is the material required for that, what are the charges for this, what are the different courses which are done for this, how this exam is taken, what are the prerequisite for it, so everything, and how to pass it easily. So everything you will get to know after some time in this lecture. Okay, now this is basically we are talking about DCH UK. It's actually a diploma in child health. DCH stands for Diploma in Child Health, which is offered by UK Royal College. Okay, the same college which offers you the MRCPCH and the FRCPCH. It is accepted in different countries. Um every country has its own regulatory body, so you just can check on your regulatory body, but it is accepted in my country and many of the Middle Eastern countries as a diploma in pediatrics. What is the requirement? Like if you want to appear for MRCPCH clinical, you need to have your FOPTS and AKP passed. Only then you can appear. Similarly, for DCH, you just need to pass FOP. Like MRCPCH Part 1, it has two portion, FOP and TS. So you just need to have passed this FOP. If you have passed that, so you can appear for DCH clinical. Okay. And this exam is conducted twice a year. And you know what is the best thing nowadays? That previously, like our seniors, they used to go to UK to appear for this DCH clinical exam, and that was very costly because you have to travel. There are a lot of traveling charges. Then you have to stay over there for some time. Then you have to conduct some courses, plus minus, and I mean, it was, and then you have to pay the fee for that exam. So that was very costly. The good thing is now it is online. You just sit in your home. There are just few requirements, and you just do that, and you just pay the exam fee, and you're done. You can appear in your exam, and you can just take the qualification, just like anyone who just went there and got that qualification. So I think this is a very good time. Actually, it started in COVID, and we don't know how far it will run online. Anytime they can say that now the online version is finished, and we will be doing it face to face. So if it converted into face to face, then I think it will be not that attractive as it is nowadays. So that's why anyone who is planning, so don't get delayed, because anytime it can be converted into the face-to-face version, just like MRCPCH. Okay, people are asking about exam fee. You can just go to RCPCH site, and in DCH you just can see over there. Uh, but also I can just let you know, usually it is varied. It varied from 500 to 600 UK pound. So, but I think nowadays it is around 550, something like that. You just can check that online. For every exam it is being changed. Okay, if people do have these type of frequently asked question, it is one of the FAQ, that what is the difference between DCH clinical and MRCPCH clinical. I would, suggest anyone who has done their part 1 and part 2, I mean, who have done AKP and FOPTS, and who are waiting for their MRCPCH clinical exam, take on DCH. Why? Because it will be a sort of your mock for your big day. And the plus thing is you will also get one extra qualification for it. Now, like, never think that DCH is an easy exam. It is never easy. It's pretty much difficult. And when I was appearing for it, because most of the examiners, they were you know the UK examiner. In fact, all of them were UK examiners. So it was very difficult, and like the way they were taking my exam, So I was thinking, like I'm appearing for my membership or some sort of fellowship exam. So it was, and everything they were asking from guidelines. So you cannot say that I'll just go and it will be a sort of shopping for me. No, it's not that easy. You just have to do preparation. That's must. Something to talk about the pattern of exam, the online version I'm talking about, because nowadays that is happening. The face-to-face version, it have few other station as well, but because it's not face-to-face now, so we'll be just talking about the online. So there are two history stations. There is two communication station. There is one development station, uh, one clinical station. It can be anyone, like it can be CVS, CNS, GIT, respiratory. Out of these four, there is one. Musculoskeletal is not included. The others, which are in like skin and hematology, blah, 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 that is also not included. Only for CVS, CNS, GIT, respiratory. Out of these four, one will come. We don't know which one they will come, but usually 80 to 90% cases, they give CVS. Uh, and if you ask me honestly, the second one is CNS. So these two are they are asking frequently. Then there is one station which is called data interpretation station. There is a data given to you, for example, just like a blood gas analysis, for example, is given to you, and you are just asked, just a sort of a small scenario is given to you that this is a boy who just born and he has difficulty in breathing, cyanosis, and when you did blood gas, so there was a type 2 sort of respiratory failure. So then there's a discussion on that. What is this data about? What is your interpretation? So you'll say this is severe metabolic acidosis, for example. Then they will say, okay, what is your plan now? What you'll do? So it's a sort of discussion on that. So data interpretation can be anything. It's a very open-ended thing. I mean, it can be an ECG, it can be an echo interpretation, it can be electrolytes interpretation, it can be just a CBC, it can be just a sort of blood gas, like I told you. It can be a picture. It can be like audiogram. So anything can come in this. So that's why it is very open-ended, and you have to do a little study for this. Then another one, which is a bit different. Okay, I didn't talk about the development station. So development station, it is just like your MRCPCH clinical, but in MRCPCH clinical, you have to take history followed by the clinical exam. But here it is only the clinical exam. There is no actually history. Communication is just like that of the MRCPCH. And history, there are two short history station which you need to ask a focus history, very short, 6 minute. It's not like 23-minute station. Then there is a safe prescription. This is a bit different one. In safe prescription, they just give you a sort of a template that there is a boy who has joint pain, for example, for the past 10 days or for the past 10 weeks. So a GIA criteria is given to you, and they have already written a prescription. Now, there are some mistakes in that prescription. For example, the doctor's signature is missing, or the date is missing, or the medicine which is written, that is not correctly placed. So you just have to work on that, and you just have to make it safe. So there will be, once you just see, you just note the mistakes, and then you will do just a discussion with the examiner. Okay. Now, talking about the time of each of these stations. So every of these station, all of these, everyone is 9-minute station. Okay. Each of this one, total 2, 4, 7, 8, total 8 station. Every station is 9-minute. 6 minute is you are with the role player. Okay. And then the 3 minute is the discussion for every station. But communication is a different one. It's 9 minutes. So it's all time with the role player, just like a communication. So it's a 9 minute directly. But the other all station, they are 6 minute and 3 minutes. 6 minute, and like data interpretation, 6 minute you just have to do the interpretation, and then 3 minutes the discussion. Safe prescription, you just have to make it safe. You just have to point out the points which are wrong, and then 3 minute discussion with the examiner. So all are 6 minute and 3 minute. And then there is a reading time. before you enter into any station, for example, you are on station 4, which is a safe prescription, you are entering into that. So before entering into that, you'll be having a 4-minute waiting time outside. A template will be given to you that inside this is the case, this is the data. So those 4 minutes are very important, and you just have to use those 4 minutes very preciously. Okay. So 4-minute waiting time, then 6 minute with the role player, and then 3 minute with the examiner discussion. People asking about the study material, honestly, the study material for this type of exam is very little. Okay, because there is no past recalls, there is nothing. I have been starting gathering the past recalls. So I think for the past 3 4 year past recalls, I have one folder. So I have been struggling very hard from one student, another student. So I really thank my student because they helped me a lot, and I just tried to gather those past recalls. So that was a very good job done, because from the past recalls, you just can get an idea what type of exam is coming, and what is the pattern. So that's it. Then there are a few books which are pretty much helpful. We all have studied these books, and these are available in multiple groups. Like one of them is the Anil Gurj. It has 2 volumes, very important. Then there is a blue book, which is a DCH clinical cases book. It is also very good. Even these 2 books will also help you in your MRCPCH clinical exam. Then there is one book, Go Pass. Uh, there are a few topics which you can read from that, and past recalls, I already talked about that. So limited material. These you cannot say that things are coming from these books, but these books, they just give you an idea that what is coming, and what is the type of exam. So you just get an idea about this exam from these books. Passing marks, well, it's a bit harsh. There are total 192 marks, and out of these 192, you have to score 160. Honestly, it's a big ask. Uh, every of my students, when they come out from the exam, when I take feedback from them, they will tell me, "Sir, I'm 100% fail." Why? Because it's a 160 is a big ask, but when the result is out, they're pass. So it's like 160 is a big ask, but uh, you know they give you full marks. If you perform well, they will not cut even a single mark from you, and end of the day, you just make it. So 1 or 2 station, if they are not well, so don't worry about that. It doesn't mean that there is any problem. Okay, in each station, like as I've told you, every station is almost, I think, 24 marks for each station, and 12 marks is for the first part, and the next 12 marks is for the discussion portion part. So total 24. So if you get 12 out of 12, so that is clear pass. But if you get 10 out of 12, so that is just pass. And if you get 8 out of 12, so that is bare fail, and 4 out of 12 is clear fail, and 0 is unacceptable. So this is the type of passing criteria which they have set. So it means that out of 12, you just have to score 10 to pass into it. Okay. And so total, every station has 24 marks, 12 plus 12. So you just need to score 20 in every station. Then marking is done like this. When you have done your exam, so they'll send your result. Result is like this in communication, 12 12. So you have scored that much. So this is sort of a result card for you on the day of exam. It's a detailed card in which every station is given to you. If it ask me what is your experience about this exam, honestly, it's not an easy exam. It's a difficult one. Like this time, 4 of my students appeared, and the result is up till now not out yet. But previously, 13 candidates of my appeared, and 13 out of 13 passed. But before the result, when I asked them what is your thought, I think only 5 or 6 were very sure that we are pass, but the other 5 or 6 they were saying that it's difficult to pass. They were even not 50-50. But end of the day, all of them were passed. So the passing criteria is better, but exam is difficult. Don't ever think that this is an easy exam. So this time, 4 candidates, my students appeared. Let's see how they did. This also, I mean, your lucky day because morning day exam, then evening. Like, for example, it's a 7, 8 day exam. One batch is in the morning, second is in the evening. Now, sometime morning is easy, evening is difficult. So it's also a bit luck dependent. So out of these 4 students which appear this time, so 3 had a very typical cases which we already have done in past recalls, and also in my course we covered those topics, so they were very good. But one candidate, one of
One of
yeah, one of my
yeah, one
students,
of my students.
just 1 minute.
Just one minute. Okay. So one of my student, like he was a very talented, and he was very good, but
Recording.
I'm audible. Yeah, okay, I think sometime the signal drops. So he was very talented, but the problem was that the day the exam he had, that was very, very difficult. He had so difficult cases. So, this is luck also. Luck really counts. In every exam, it counts. So, similar is in this exam that it does count. And he was unfortunate. But anyhow, result is not out yet because he is very talented. So, I hope that he will also pass it. Okay. Now, how to get through? Like, you know, any exam for which you have not done training and for which you have not been in the system. For example, if you're living in India and you're appearing for UK exams, you have not seen the UK system, you have not appeared in that exam before, you have not done coaching for that. So it's a bit difficult. It's not like this that people are not passing without courses or coaching. They are passing. Why not? But maybe on second attempt, maybe on third attempt. So coaching, it just make you it make your life easy. It's not like this that they just give you something extra. It's just like a car on a road. So they just take the car on the road, on the highway, and then you drive yourself. It's not like this that the teacher will be driving, you will drive, but the teacher work is just to put you on the highway. So there are many courses, you just can attend anyone. And I'm also coaching, and my next batch is also starting soon, so we also can contact me. So this was all about just a very brief sort of an overview about this DCH clinical exam. So now I open this for all of you if there is any question. I also have recorded this and I'll put it on my YouTube channel, so you can just watch it later on as well. So if there is any question, I'll just take on that. Yes.
Dr. Tahir, Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam wa rahmatullahi wa barakatuh, Dr. Hassan.
Good morning, Dr. Tahir. In my side it's morning, but I'll say good day to you, Doctor.
Thank you.
Thank you, Doctor, for this introduction into the course. Dr. Tahir, my questions are first, I keep having people discouraging me, telling me no need for the DCH since you're going for the RCPC clinicals. But somehow I have this nagging feeling that it's also an important okay to hold on to if you have any inclination of going towards the UK. What's your opinion about it? And how long should one prepare to be able to go in for the exams?
Yeah, I mean, if you're talking about DCH, you're talking about
Yes.
DCH or MRCPCH?
No, I'm talking about DCH and the
DCH.
relevance.
Okay. So first of all, if you think that DCH will get you GMC, so that's not correct. DCH is not going to give you GMC. In COVID era, when UK were in need of a lot of doctors, so they have given GMC on DCH to many people, because every country was in danger and every country was in need of doctors by that time. So same was the case in UK, because every day there were around 1 million or 2 million cases every day. So they were in need of doctors. So they just relaxed everything, and they used to give GMC to DCH and everyone who had anything. But now with DCH, I think you are not gonna make for the GMC. But yes, it is a sort of an extra qualification. Like for example, you have done your MRCPCH clinical and you're going to UK, but there are two candidates. Both of you have equal score, but you also have a surplus DCH, so you will be considered over that other candidate. So it has definitely a plus mark, and it is also one extra qualification. So definitely it will help you in that regard. The other question regarding time duration. So honestly, it depends upon what is your pediatric background. So that is very important. But if you have some sort of pediatric background, then I think that 3 months are more than enough. Okay, because this is an online version, and you need to practice. But this 3 months is not like this that you become a bookworm and you sit for a book. No, discussion is required, because it's a verbalizing exam, and you need to learn the sentences which you need to speak. Like for example, if I ask you do the abdominal examination of this child, now that may be very easy. But if I ask you to speak how you will do abdominal examination, then you might be a bit hesitant. So that's why the practice is the key to perform. And like, because I had a very good pediatric background, so I have done this in 32 days. So if I can do it in 32 days, so anybody can do that in this, even earlier than this. But what I feel on average, I think 2 to 3 months are more than enough. Yes.
Okay, thank you, doctor.
Yeah. Yes. Any other question? Anything regarding this exam? Anything? I'll be more than happy to answer. Okay, so yeah, thank you so much everyone for joining. And
Hello,
it
uh,
yes,
Doctor,
yes,
1 minute.
yeah,
So
okay,
I was
okay, yeah, yeah.
confused to what extent the theory part we should be able to cover. Like you have given only these two volumes, no? The Anil Garg and DCH online, so DCH
Yeah,
clinical cases book. Will those two be sufficient, or like anything else particularly we need to study on?
yeah. That's that's a very good question, and many people they are asking these type of questions. I tell you, see, guidelines are very important. Okay, like the guidelines, pediatric guidelines particularly. It's not like this that you go through each and every guideline, the guideline book. That one I'm talking about. Not necessary to go to everyone, but there are few things which you just need to do from that book. Like for example, DK protocol. Like, because data will be coming to you, and then there will be a discussion portion, and it's a 3 minute time, and they're asking very quick quick questions, like 8, 9 questions they are asking in 3 minutes. So, you just have to give a very compact answer in a very short period of time. So for that reason, you have to have a sound knowledge of the pediatric guidelines. So I will always advise to go through the pediatric guidelines. Not all, there are few which you just have to go through, which are coming in exam. And then for communication, I will advise to also go through the Rebecca. Rebecca is a very good book. It's not like this that you just memorize this so that things will be coming from it. No, it's just like that you just, have an idea that how is communication done, and then you practice it with someone under supervision of someone who is expert. Because what people are doing, that they are making groups and they are doing discussion with each other, and they don't know that the things they are practicing, that is correct or not, and that thing becomes consolidated in them. And when they appear for the exam, the mistakes which is consolidated, they perform that in the exam as well. So I always give this suggestion to do it under someone who is expert and who is supervising you. That is very important. Okay, at least not always, but at least sometime, so that if you have some mistakes inside you, so he or she just pointed out those mistakes and they are corrected. And then this book which I have shown you, this blue book, the DCH clinical cases book, that is also very good. Like when we were preparing, honestly, we had just this one book. Anil Garg, we did not aware of that book. Only we had this blue book, and we just prepared from that book. There were no recalls. Nowadays, there are so many recalls. You just can take an idea that uh, you know how this exam will. Uh, how the things are coming in this exam. So yeah, it's a very limited sort of material, and there is not too much study in this. So this is not that much difficult exam. Only you just need good orientation. That's it. Yeah. Anyone else with any question?
In worst cases, yeah, last in December, November DCH, I got newborn examination in as a clinical station. So I was shocked really because I've not prepared exactly the format of how to start with or how to end with. So that is one area where it's very unexpected.
What type came for you?
Newborn examination, that's it.
Yeah, exactly. Actually, newborn. That's why in my last course, I teach them how to do a newborn examination, because as I've told you, anything can come. And even we did with them the neonatal reflexes, which are done, because now they're asking anything can come. And even things are evolving. Like previously it was that they used to give a scenario, that this is a scenario, and do the CNS examination. For example, hemiplegia, a child unable to walk. Now what they are doing, that they show you a video of 6 to 7 seconds in which there is a hemiplegic gait. This happened not the last day, the second last exam before this. Yani it was a December session, I guess, maybe your session. So they just show a short video in which there was hemiplegic gait, and then the discussion started that okay, how you will examine this child, power. So how will be the power? How will be the tone? So this then started. Then they start discussion about the hemiplegia, what are the causes, or how you investigate, how you treat. So things are evolving, as I'm telling you, over a period of time things are evolving. Like previously, what they used to do, that in safe prescription station, they used to give you a prescription. You just see that, you just correct the mistakes, and you just check the dose. You were given an access to the BNF. You used to open your BNF during the exam, and you just check the dose, and you just correct the dose. But now what they have done, that they are not giving you BNF, rather they are giving you just that page on which this drug is there, and you just have to see that, and you just have to calculate the dose yourself. So things are changing. They sometimes they make few things easy, sometimes they make few things difficult. uh, so yeah, so what happened about you? You then cleared in that exam, or
No, no, no.
unfortunate?
I couldn't able to clear that exam actually.
How much you scored, if you like to tell us?
156.
Yeah, so everyone is like this, you know, they when they cannot succeed, so they're just there. So you know, it is only mere a matter of few marks. I'm telling you that it is not because that you are not good in knowledge. It is only, I'm 100% sure. I have not judged you. I don't know you. I don't know your background, but I can tell you that this was only because that uh, you were not maybe familiar with the pattern, or maybe.
So that's true.
Yeah,
Actually, in one
yeah,
session, I missed to see the pictures which they have
yeah,
given. I missed to scroll down to the second page, where in the second page there is some description given, like
yeah,
safe prescription. So that is where I have missed it. So, but again, I requested examiner to go. I want to go back and again check that, but he didn't give me the option. So that is one area, and development mein the other area. So yeah, somehow I
yeah,
missed.
that the yeah, these, because you know, you would have felt, because you already appeared, so you would have felt that the only thing which is difficult is time. Very short time.
Exactly.
And
Exactly.
you just have to develop this skill, and for that skill to develop, you just need a forum. So that's why it is important. Similarly, like I always take feedback from my students. Like I was just doing this type of orientation session some, I think, few months back, and one candidate, she told me that she failed because of the reason in development station. What happened that they gave us a box, and they told me that do fine motor examination. I didn't know that I have to choose the things from the box, the things which are available in the box, in the picture which was shown to me. I just have to use those. So she said that I was doing the domains of fine motor which were not present in the box. For example, string was not present in the box, but I was just asking about, can he uh, pass the thread in a large bead, small bead. So you know, these are the things that if you don't know, so on the day of exam, I mean, you can be screwed up. So it's not about knowledge, it's just about, you know, you just practice well, and you just know the exam. So that is very important. So hopefully you will pass. You just prepare this time. I'm sure you'll be
Yeah.
better
Thank
than
you.
many.
Sure.
Yeah,
Yeah. Yeah.
yeah,
Thank you.
yeah, welcome. Okay, anything else, anyone? See, that is a good discussion. So whenever you have such forum, you have a class, so many things come out, and you learn many things. So hopefully it was beneficial, and we'll be doing every now and then these type of things. And I will just upload this lecture on my YouTube channel. So anyone who are interested, who wants to see it, so they just can uh, go there, and they just can listen to it again. Thank you so much, everyone, and yeah, thank you. Take care, everyone.